Hello, everyone. So, welcome to part 5 of our NEET PG counseling series. And today we'll discuss radiation oncology as a branch for your upcoming NEET PG. And I'm very excited to introduce to all of you Dr. Rituraj, who is also my senior from AIMS and has done his MD in radiation oncology from India and is currently in the US practicing radiation oncology. Heartfelt welcome to Rituraj. How are you?
I'm doing good. Thanks, Rishabh, for doing this. I think it's a great venture. Just talking through. I've had a lot of friends and juniors, and some of my cousins who are preparing for NEET, and they always keep asking me these questions. So I think this is going to be a good series.
Thank you so much. So, Rituraj, it would be really good if like you can introduce yourself.
Yeah, absolutely. Yeah, let's go with that. So, uh, as Sship told already, Rituraj, I graduated from AIMS. I did my med school. Was class of 2009, so I finished my med school in 2014, and after that, I did a radiation oncology residency from AIMS New Delhi itself, which was a very interesting story. I was hardly exposed to radiation oncology during med school, which is the case with most other med students, right? So the only exposure I had with radiation oncology was trying to find where the department was so that I could get signatures on my internship completion or whatever at that time. So I did not really know much. And then there was this question, a couple of neat questions which always kept creeping up, that what's the radiation dose we need to give to point A for cervical cancers? And those were the only two things I really knew about radiation oncology. So how did I get into this field? Well, the counseling for AIMS used to be in person those days, and you would, walk up to the stage and they would ask you, what do you want? And you had to give an answer right there. So I had a decent rank. The AIMS preference thing was kind of non-existent, so it did not help much. But ultimately, when I walked up the stage, I had few options, and I was just looking at the list, and I saw radiation oncology as one of the options, and I was like, this looks interesting, and this looks looks like maybe it will be radiology like, and you would have a chill life and you can just enjoy your days. So I ended up picking it. In the back of my mind there was always a thought that and I wanted to do pediatrics, to be honest, nothing else really. That was one of my top choice, and I couldn't get that at AIMS. So in the back of my mind there was always this thought that maybe I would try to give the exam again next year and try to get pediatrics, and let's just pick up radiation oncology for now, and we'll see how it goes. So that's how I got into Radonc. And to this date, I think that was the best decision I've ever made in my life, to pick Radonc, because it's a very underutilized or underknown branch in our medical field. So talking about my journey since then, I did 3 years of residency, which is what's the case at most places. So I did that at AIMS. I started my SR-ship there, but I stopped after like about 6 months, and I moved to the US. I did a couple of fellowships here. I did a residency again at Ohio State, but I could have just continued with some fellowships, and then you end up, there is a pathway where you can do about 4 years of fellowship, similar to radiology. So radiology and radiation oncology come under the same board in the US. So if you are able to get through that 4 years of fellowships, you get board certified in the US and you can practice here. So that's what I'm doing now. But as I said, very happy I got into radiation oncology, and rest is history.
Amazing journey. And this is one of the stories that I tell a lot of students, that don't be disheartened if you didn't get the branch of your choice. Maybe the branch that chooses you is the branch that you'll enjoy the most throughout your life, and you'll be happy that you chose it. Okay, so don't limit yourself to the cream branches or the branches that everybody chooses. The world is now an open oyster. You choose what you want to do, and through this video I want to help all of you know what potential each branch has, especially the lesser known branches. So, what we'll cover in this video for our audience, I'll say that we'll cover the radiation oncology residency, what all things were included in radiotherapy, and how does the residency look like. Then what are the options after MD? What are the salaries that one can expect after doing radiation oncology? And finally, what are the opportunities outside India? So, first of all, Rituraj, let's just start with the radiotherapy or radiation oncology. What does the residency or what does the branch entails?
Sure. Yeah. Yeah. Like you said, sometimes the brand chooses you, and I'm a big Harry Potter nerd, so I think it's like I did not choose my wand, and the wand chooses the wizard. So that's what actually happened. But that aside, the things which happen in radiotherapy or radiation oncology, it's a consortium of different things which you need to know and need to learn. Uh, the exam and the course itself in India comprises of four parts. So number one is medical physics. So you need to know a little bit about physics. Number two is radiobiology, which is what we all learn in chapter 7 of Robbins, the chapter called neoplasia. So we expand on it a lot, and we need to learn how cancer develops and a lot of cancer biology. Third part is a little bit of chemotherapy itself. We do have to know a little bit about systemic therapy here and there. And the fourth and most important part is clinical radiation oncology. It's like how we design and deliver radiation for patients who need them. So those are the four major components. I would say a couple of other things which help you in this journey and you need to know a lot is imaging. You would not realize this at first, and maybe not that much in India, but like where I practice now in the US, we rely heavily on imaging, and sometimes we are always at fist fights with radiology, and we feel like, oh, I think I can see this better than you. But anyways, so you need to know a lot about imaging, but that's only limited to oncology imaging, not non-oncological imaging. And then also you need to know a lot about anatomy, which is kind of a reflection of imaging. You need to know what are the pathways tumor can spread to different parts of your body. So those are some of the important components of not only your residency training, but also, mastering the art called radiation therapy. So in terms of your residency itself, it's going to be very variable, like what depending on what place you are doing your residency. Everybody would be a different person. Every place operates thing in a different manner, but a typical day of a radiation oncologist is this is what it looks like. You see outpatients in clinic, so we do have a OPD where we would see patients just like any other specialty, and we would make a treatment recommendation, treatment plan. We would prescribe general medications. And typically, we see mostly cancer patients. The most common cancers we see are the most common cancers which are there in India. In men, head and neck and prostate cancers. In women, breast and cervical cancer. So they comprise the majority of our patient population, especially in India. And then after seeing patients, you typically get imaging, workup, and once all the workup is done, you come to a plan like what kind of radiation and what areas you want to treat with radiation for a patient. And all of this outpatient part was a small component. A lot of action happens behind the scene. We use all the scans, and we get additional scans to design the radiation. So a lot of time you are spending is you are literally sitting and drawing tumors on a scan. So we would have these MRIs and CAT scans, and say you have a prostate cancer, you'll be spending a lot of your day drawing prostate in 3 dimensions, and then just learn what are the areas at risk of having cancers and draw all of them. And you draw a lot of other normal organs around that too. So you spend a lot of time doing that. You need medical physics background. So there are some physicists you work closely in conjunction with who plan these radiation techniques, and you make sure you are delivering the most optimal radiation to a patient. So a lot of time is spent in doing all of that. Lastly, some places also have inpatient units, like AIMS itself has
Yeah.
I think about total of about 45 beds
Oh,
dedicated to
that's,
radiation
yeah.
oncology, including like, private beds and whatnot. So that's AIMS New Delhi. So there are people who take care of the inpatients as well. So you would be on call overnight, just taking care of those patients. Those patients are usually not very needy. They are not like, ICU patients that you have to frequently like sit at the bedside or something. No, it's mostly, just making sure everyone is doing well, and yeah, so that's kind of what your residency would typically entail.
So what are that was a very detailed description of what are the all things that a radiation oncologist covers. I just want to highlight and just want to ask you, in fact, what different modalities are there in radiation oncology nowadays? Because I am assuming with technology, it is a heavy tech dependent branch. What new modalities have come up in radiation oncology?
Yeah, that's a great question, and we survive based on our inventions. How things used to be 30, 40 years ago are not the same anymore. We have
Yeah.
all these fancy linear accelerators which can deliver pinpoint radiation, and then with time we've developed gamma knife and cyber knife units which can cyber knife is just really means an invisible knife. By radiation itself you can cut through tumors and whatnot. And we have new different machines, like look up zap you'll just see the picture of how amazing scientific technology can be. It's like a vaultless linear accelerator which looks pretty. Like if a hospital installs a zap, a lot of patients are going to just get there just because of the visual beauty of that machine itself. And we have also brachytherapy, which is a type of radiation where we can get the radioisotope inside someone. So like those are some of the modalities which not all the places you are going to do residency may have. So it's important to know, like if you are picking some places up, like, oh, you want to do radiotherapy there, it's important to explore, ask people around, like what these centers actually have. Do they have a linear accelerator to treat patients or not? So that's very important to know.
So, in a good residency program for radiation oncology, what would you say the students should look at? Which modalities are a bare minimum?
Yeah, so I would say having a linear accelerator is a bare minimum. AIMS New Delhi has three Cobalt machines and three Linux at this time. Cobalt machines are common. A lot of places would have them. So if a center does not have either of them, you probably should not go there for residency. And I know there are a couple of centers in New Delhi where there is radiation oncology residency, but they don't have even radiation machines. I don't know what they do, but there are radiation programs which don't have radiation machines at all. So you want to make sure the program has some equipment, and preferably a linac, and that will equip you with all the things you need to know about radiation.
So, if you are aware, can you name few good radiation residency programs in India apart from AIMS New Delhi?
Yeah, so it's great. I think the two top programs, I don't even believe. I mean, I'm very biased towards AIMS, and still, I would say the top. It's maybe not the top program in the country. The couple of really good places would be Tata Memorial Center in Mumbai and PGI Chandigarh. So these two are really good, and along with AIMS, these three are probably the best three centers in the country to learn and practice radiotherapy. The other good places are a lot of them in southern India, like CMC Vellore. There are RCC, Regional Cancer Center in Chennai. Some places in Bangalore. I think HCG may have a DNB program. So
Yeah.
these are some of the other good places. So yeah, that's kind of like, I'm talking about kind of top 10 programs in the country.
Yeah.
Uh, so yeah.
So, I think like radiology, since it also involves a lot of machines, I'm assuming that even DNB programs for radiation oncology would be equally good.
Yeah, it's a hit or miss. So it's like it depends on what place you're working in.
Yeah.
Again, you need to make sure you have the right equipment. There are a lot of DNB programs in Delhi. I mean, I think I met fellow couple of last week who did his DNB from Max Hospital in Delhi. He seemed decent. He seemed to know things. So yeah, I think some of the DNB programs can be good, but you have to make sure you know what you're getting into. Like, do they uh, do they have linear accelerators? And then I think with DNB you want to make sure the pass rates and stuff, which is again very important. After you do MD, you just have to pass an exam, which I also did. and it's a very realistically simple exam. But make sure what the place where you're going to do your DNB has a decent pass rate. So, and you can look that up online, I think, nowadays.
Okay. Yeah. So now we'll come to after MD, what to do after MD. So
Mhm.
there are few options, right? So you get into an SR-ship, complete your SR-ship, then get into an academic post in one of the medical colleges. Or maybe you do a fellowship or you join a private hospital. Is SR-ship usually required? Would you recommend doing that? And if not, what are the various fellowships that are available?
That's a great question. Great question. At the outset, I would say that the first thing was in the last few years. So medical oncology is a relatively new field.
Hmm.
It's radiation oncology has been around for probably 50 years in India now. It started in
Oh,
1970s. Like one of my mentors was like graduated from Radonk residency in 1974. That's what he always says. Medical oncology came in late 90s, so that's and it's flourished and more colleges came up. So about last 10 years or so, we used after doing radiotherapy, you used to be eligible to write a medical oncology exam, which is I think not the case, but there is a not the case anymore. But there is legal proceedings going on over that, and I've never been one who favors like after you do radon, why do you want to go to medical oncology? It doesn't make a lot of sense. So that's a career choice. I don't think it's if you really want to do medical oncology, you should probably not be doing radiotherapy. There are a lot of other options. You can stay in an academic practice at a government institution, and for that, you would definitely need to do 3 years of SR-ship. Like a lot of other specialities, I don't think 3 years is enough to learn all of radiotherapy. There is a lot of nuances. So you definitely do want to do a SR-ship, and then it's of course that's a requisite for getting into government institutions. There are a lot of them. So if you want to get a government job and stay at a institution, I think that's a very good
yeah.
possibility. You can work at one of those centers which don't even treat patients with radiation, but still they have a department, and you're still making the same money as everyone else because it doesn't matter. Like at a government hospital, everyone makes the same amount of money. Just depends on what position you are at. Talking more about private institutions, that's very nuanced, and that's very dependent on what place you are looking to stay and what's your end point in life, really. If you want to stay in one of the bigger cities like Delhi, Mumbai, or whereabouts, you would probably need more experience, especially like a SR-ship. Uh, I mean, I had some job offers at private institutions in Delhi right after residency, but they would be a post called junior attending. So
Yeah.
that's really you are kind
Yeah.
of a SR
Yeah.
at those institutions.
Definitely.
So
Yeah.
um, that's something there. So it's always good to do a SR-ship if you are looking to go to not like one of the bigger cities, like a smaller place somewhere else where there is a good radiation setup. I think you can get away without doing a SR-ship. So.
So, what are the various fellowships that are offered after radiation oncology?
So there are a lot actually now coming up with all these advances in radiation techniques. So there are brachytherapy fellowships, which are typically gynecological cancer related fellowships, and then there are also some CNS gamma knife fellowships. There is this specific called a precision radiation fellowship, which entails doing stereotactic treatments for brain like cyber knife or gamma knife. So these are offered at certain institutions all across the country, and if you are interested, you can do that. But those are very specific fellowships. So if you end up doing a residency at a place where these things are not offered, then it's a good idea to get through those fellowships. I would say outside of India, especially in the US, there are many fellowship opportunities in the US. And I know at least like 4 to 5 people from India who moved to US just to do those fellowships after residency. And I'm saying 4 to 5 every year. Um, so and they are all across the country. They are non ACGME accredited fellowships, so most people can apply as long as you have done your step 1 and step 2 exams. You would be eligible for those fellowships.
Great. So, so you mentioned about precision radiotherapy, and I just want to add on to all the viewers who are listening that there's a treatment called SBRT, which is stereotactic radiation therapy, which is actually done by radiation oncologist. And I'm talking about it because we also treat HCCs in interventional radiology, and we are often at haunts with radiation oncology, whether the patient goes for SBRT or whether he goes for TACE or TARE. So again, radiation oncology does treat a lot of tumors, and it is in fact a very, very integral part of any cancer center in India. They would require a medical oncologist, a surgical oncologist, a radiation oncologist, a pathologist, and a radiologist. So these five people are an essential part of any cancer care in India. Thank you. uh, yeah, right. Now I want to ask, especially, what are the salaries that someone can expect after MDs? Because that is one of the major questions that people ask.
Yeah, that's again a very good question and very nuanced. You know, it depends on a lot of factors, where you are, what kind of place you're working in, and what kind of background you have. So before I say I talk about India, I would say radiation oncology is one of the top paid branch in the U.S. You can look it up; like it's always in the top five, usually third or fourth after neurosurgery and plastics. So that's the case in the US. That probably is not very true in India. And the reason for that is, if you're looking at averages, a lot of people, even if they're earning a lot, would average out with the ones who are earning less. It's all about, being the chief or the chief radiation oncologist at a private setup in India would
No.
make you earn a lot, but everyone else may not be earning that much, because your patient's always coming to the
Chief.
the
Sure.
chair or whoever. uh, that After clarifying that, so let's talk about private practice and government jobs separately. As I already said, in government jobs, you're really making the same amount as every other assistant professor, be it a neurosurgeon or even like someone from community medicine or PSM or I think even a pathologist. Everyone makes the same amount at the same level. If you are a first early attending, after right after you complete your SRship, you are making that somewhere around 1 to 1.5 lakhs a year or something, a month. Sorry. So yeah, that's kind of like standard, and it depends on the national averages. Moving beyond government jobs to private practices, there is again a very wide split between going to a smaller place and running your own center versus staying in one of the major cities like Delhi or Mumbai. If you're staying in a major city, you're probably starting off close to like 2 lakhs or so, and then you can keep going high depending on how long you work at that place. And if you end up becoming a chief of a center, there is no limit really. You can, I don't know, you can make any amount of money. It really depends on how hard you are willing to work and how much time you're willing to spend. And there are a lot of endorsements after that as well. So when you're buying all this equipment, you have to leverage some of your connections to get those equipments for the hospital, and that can get you a lot of revenue as well.
Mm.
I know some of my colleagues from uh, Apollo and other hospitals in Bangalore, in Chennai, who make more than a US radiation oncologist as well. So and they are not like they are about to retire. They are relatively young, in their late 40s.
Sure.
So that's something which is very, very feasible.
Mm.
Um, the and other aspect wise, if you go to a smaller place outside the city, you're probably making around 2.5 lakhs or so to start with, if you are kind of leading that smaller place. So all of that is possible. The other problem with radiation oncology at the moment is it's not a branch which is like picked up very early during counseling, right? Because most people don't know about it, right? And because of that, like the people we have in radiation oncology are not the ones who are most dedicated to making their lives and be successful. So that kind of takes a hit. Because of that, you don't see the bigger picture.
Mm.
But I've known like people who are dedicated to the field, they have been very successful across the board. So yeah.
Yeah, that is very nice to hear. And this was, this was usually the case with nuclear medicine as well, a few years back. But, I frequently see many, many toppers even taking nuclear medicine. So when I joined radiology at PGI, the rank 13, he took nuclear medicine by choice. And the same year in AIMS, rank 5 took nuclear medicine by choice. So, things are changing a little bit because if you talk about the salaries just after your MD or just after your SRship, they are not really different as compared to the clinical branches, and the work life balance that you get in such branches are much much better than any clinical branches. And I think radiation oncology, and I hope radiation oncology gets the due justice that it deserves very badly in India especially. And I hope that students do get to know about this branch through this video.
Yeah, the work-life balance is a big perk. I mean, and I realized it over time. Like, your weekends are always free. In US, you get 2-day weekends, but even in India, you're never getting to work on a weekend most of the times. And then it's like radiology. You sit in the front of a computer for a long time, but then you also have that patient communication. So if you feel like I got into medicine to see patients, you still have that. The only difficult thing is, and you have to know this before getting into radiation oncology, is the oncology aspect of it. So you're dealing with cancer patients, so communication skills are very important. These are very sensitive patients to work with, so talking to them, it's a art. And in my personal experience, I have noticed like all the radoncs are better equipped in this than medical oncologists, because they start off by internal medicine, and you learn the oncology aspects very late, while we are we are dealing with these patients right after our residencies. So overall, and we have more time, I guess, to dedicate to talk to them. These patients need a lot of uh, uh, you have to show them your empathy, and give your time to talk to them and explain things, and that will often go a long way in their care. So
Yeah, few of the things that I want to clarify is that do
sure.
radiation oncologists prescribe chemotherapy?
I mean, ideally, you can, because we pass an exam. Chemotherapy is a part of our board certification exam in India. Like your MD exam would be 1/4 chemotherapy. So technically you can, but then it's also very institutional. Like when I was training at AIMS, we would do a lot of chemotherapy for all of our patients. We had our own inpatient units, but over time, like if you have a dedicated medical oncologist at your hospital, you would probably let them do most of it. So it's always a struggle. Like say for lung cancers, who does the treatment? Is it the pulmonologist or a medical oncologist? So
Yeah.
this struggle is always there at every hospital, and it depends on, it's very institutional. If you end up going to a smaller center, um, where there may not be a medical oncologist, so as a radonc, you may be doing all the chemotherapy. So uh, it's a nuanced question. I can't really give a universal answer to that. Uh, in the US, radoncs don't do chemotherapy, and we don't need to. I mean,
Yeah.
why do I have to? I have to do like more of like my own things.
Right.
But yeah, radoncs are the other good aspect of the specialty, is that you are always part of tumor boards and the DMGs or disease management group. So you are working very closely with your surgeon, your medonc, your radiologist, and pathologist. So it gives more opportunities to collaborate not only on research but also in the clinic, and have a good circle to hang around with.
Mhm.
Like I'm gonna be a CNS a CNS radonc, so I'm gonna meet like neurologist and neurosurgeon more often than other radiation oncologists even. So it's a
Right.
very nuanced branch.
Yeah, I think that's true for interventional radiology as well, because I currently work in a gastro team with the gastroenterologist and the liver transplant. So I meet them much more often than I meet fellow radiologists or fellow interventional radiologists. And most of the
Yeah.
tertiary care hospitals in India and abroad now are working in sort of a team-based management. So they have their own radiologists, they have their own in-house pathologist maybe, and which take care of their entire unit and the team. Great. Last question that I want to ask that unlike radiology, some people think that owning your own setup in radiation oncology is not feasible. So first, do you know anybody who in private have their own radiation oncology unit, or is it actually feasible or not?
Uh, Actually, yeah, it's in terms of being feasible, I would say yes. I definitely know a lot of people who have their own center in, underserved areas. Like there are a lot of places in the country which does not have access to radiation, and if you go there and establish their own center, your own center, you can. Now you cannot do that in a big place like Delhi. No, you definitely cannot. Go to Delhi and say I'm going to buy a Linac and run it. That's probably not possible. And you'd probably need some funding or some entrepreneurship to try to help you build your own center. And then lastly, you have to know like cancer care cannot be unidirectional, or you need an entire team. So you can build a hospital, but you may not get the adequate amount of patients. So ultimately it's like you're just sitting at a radiation equipment and just doing what someone else is telling rather than making a multidisciplinary team discussion. So most people I know and most people who are successful, they work with associated with a bigger institution or a cancer center or academic hospital. So
Okay, I think that pretty much sums it up. And that is also true for interventional radiology as well, and nuclear medicine as well. So all these three things, I think, are almost similar in that aspect as well. So I think with that, we have almost covered everything with regards to radiation oncology. And if you have any questions regarding radonc or radiotherapy, you can put them down in the comment section. We'll be happy to answer them. And for now, that's all from our side. And we'll see you in the next one. Any parting words from you, Rituraj?
no, I would say thank you for having me, and I always like to advocate for our branch that it's so good, and still it's like an untapped resource for people, and I hope we get some very dedicated and enthusiastic people in our branch who can take it to much greater heights, which is the case in the U.S.
Yeah.
It's a different branch altogether compared to India. All the top med students in the U.S. get into Radonc. You need like super high step scores to get into Radonc in the US. In compared to internal medicine or family medicine, which is the easiest to get here.
Yeah.
So I hope 10 or 15 years from now we'll start to see that change in India as well as we